So I'm James Kirkbride. I'm a researcher in the Division of Psychiatry, and I'm a senior research associate in the department. I'm an epidemiologist by training. So my big research question is understanding how the environment increases our risk of developing severe mental illness like psychotic disorders such as schizophrenia or bipolar disorder. I'm predominantly interested in understanding more about how our neighbourhoods increase our risk of developing disorder, as well as what increases risk in different ethnic minority and migrant groups. So one of the things we know is that people who are ethnic minorities or first-generation migrants, so born abroad, moving to many countries in Europe, face an increased risk of developing schizophrenia. We're not sure why that is. There's been many hypotheses. One of the areas I'm most interested in is understanding what social experiences those migrants and ethnic minority groups go through to increase the risk of developing the disorder in it. My research is primarily involved in trying to identify things that happen over your life, whether that's the experience of discrimination or living in a very deprived area, or coming from having lots of different social experiences which are seen as traumatic. So the research I do is important for society because experiencing severe mental disorder like schizophrenia or other psychotic disorders is very common. Over 1% of us around will develop schizophrenia or another psychotic disorder during the course of our lifetime. And for that reason it's very important that we can try and work out what risk factors there are for disorder so we can try and prevent people from developing those illnesses. So I'm interested in very much the social risk factors for disorder, and of course there's a strong genetic component to the causes of psychotic disorders, but it's only really the social factors that are preventable. And if we can prevent those, we might be able to lower some of the risk of disorder. This research is also important because people who experience schizophrenia and other psychotic disorders often have episodes which go through their life. So you'll be in remission for quite a long time, but these episodes of hallucinations or delusions can come back. And what the wider research tells us is that when you intervene earlier in someone's illness, they have a better course and outcome of disorder. And so another reason why we're trying to identify those factors which increase the risk is to try and prevent those factors so that people who have the disorder can improve their lives and return to work and live active and normal lives as far as possible. So far in my research, I found that people living in very urban, very deprived neighbourhoods have a higher risk of developing schizophrenia. Now we've got to remember that actually the risk of experiencing disorder in any one year is very low, but people who live in urban areas do experience more psychotic disorder. A big part of what I'm trying to look at is whether that risk is causal. So I'm interested in whether or not people move into those areas as a consequence of their illness, or whether those areas themselves try and actually increase one's risk. So the research I've shown to date shows that people living in more deprived, more, as I said, more urban areas have an increased risk, but it's not just deprivation per se that increases risk. We also know that social isolation and the extent to which communities are cohesive and integrated seems to have an association with the risk of disorder, so that living in more isolated or less socially cohesive neighbourhoods seems to increase one's risk. This is particularly true of migrants, and one thing that I've shown is that when you're a member of an ethnic minority group, if you're around fewer people from your own ethnic minority group, we seem to see an increased risk in those groups compared to when you're in an ethnic minority group living in a larger community of people from your own ethnic background. And that again suggests that some factor like discrimination or isolation might be important in increasing people's risk. So that's what I found so far.